is this just a pimple or is it something more? Have you ever had a bump on your skin that just doesn't go away? It stays there for weeks, months, and you keep thinking it's just a pimple. And some people ignore it or they call it a pimple and wait, but very often it is a basal cell carcinoma or BCC. Interesting fact, basal cell carcinoma is not only the most common skin cancer, but it is also the most common cancer in general in humans, which means the odds are you know someone who's had it or you've had it yourself. In today's video, we will focus on the type of basal cell carcinoma that is often mistaken for a pimple. We will look at some images and discuss how to recognize it early. But first, welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. I'm also founder of the Skin Clinic Mindful Medical Care, where I treat both benign and cancerous skin disease. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. So the type of basal cell carcinoma that looks like a pimple is actually the most common type of basal cell carcinoma, and it is called the nodular BCC. These lesions are usually smooth, slightly raised, and flesh-colored or pink. What makes them stand out is the surface. They have this subtle shine, almost like they reflect light differently than the surrounding skin. And some people describe them as looking a little translucent. In the medical world, we describe them as pearly lesions, perhaps because of this shine and translucency. And if you look closely, you may see tiny blood vessels running across them. And that's a very classic feature. So why is it missed sometimes? The reason this gets missed so often is simple. It doesn't look aggressive, it doesn't hurt, it doesn't grow quickly. So people assume it's nothing serious and they leave it alone. Months pass, sometimes even years. At our clinic, I've seen a number of new patients who had this for several years and were surprised when I told them that I was concerned. In general, the most common story that I hear when it comes to these nodular basal cell cancer is this: I've had this for a long time, it doesn't bother me, but it never really goes away. And that is the key. Unlike a pimple, which comes and goes, this one just stays. It may change slightly, but it really doesn't resolve. It also may bleed, it may get inflamed, and it usually grows over time. The risk factors for this cancer are chronic sun exposure, and that is a major one, along with fair skin and a history of sunburns, and in general, cumulative lifetime UV exposure. Of course, tanning bed is a huge risk, and I want to emphasize that. And you'll most commonly see these on the face, especially nose, cheeks, and forehead, but they can also appear on the back, chest, and other sun-exposed areas. Once we diagnose this, patients often ask, what happens if I don't do anything, since this is not an aggressive cancer? Well, basal cell carcinoma grows slowly, but it doesn't really stop. Over time, it can grow deeper into the skin, break down the surface, and form an open sore. It can also invade nearby structures like cartilage, especially on the nose or ear, and gradually destroy surrounding tissue. So while it rarely spreads to distant organs or lymph nodes, it can become locally very destructive, especially on the face. And that is why it should not be left alone and it should be removed. On that note, early detection matters. The good news is when caught early, treatment is usually straightforward. Smaller lesions are easier to remove, less invasive, and typically heal with better cosmetic results. But the longer it sits, the more complex treatment can become. So how is it treated? Treatment is surgical. Because these lesions are already raised and extend into the skin, they're not really amenable to topical creams or simple cryotherapy or freezing. They have to be surgically removed. The key point is removal is very effective, especially when done early. Most importantly, how do you protect yourself? How do you prevent this from forming in the first place? Sun protection plays a major role. Regular use of sunscreen, especially on the face, can help reduce your risk over time. And as I always say to my patients, please use sunscreen SPF 30 or above all year round on the face, and also scalp and ears if they are exposed, even in the winter, even indoors. In the warmer climate, please apply sunscreen to all exposed areas and reapply after 1.5 to 2 hours in direct sun. It's also important to pay attention to your skin and have any new or changing spots evaluated early. Again, not all nodular basal cell is on the face. And if something doesn't look right anywhere on the chest, on your back, or it simply doesn't go away, don't wait. Getting it checked with your doctor sooner makes everything easier. Thank you so much for watching. I'm looking forward to reading your comments. Please don't forget to like, share, and subscribe. Until next time, bye-bye.